Okay, well, thanks everybody. Welcome again to our Rural Conversation community. This is definitely becoming one of my favorite parts of my week is getting to see all of your wonderful faces. Again, this is an opportunity to try to build a community of support around rural issues. This conversation community is a service of the ILNet National Training and Technical Assistance Center, a project of independent living research utilization, or as you know them, probably ILRU, and is facilitated by APRIL, the Association of Programs for Rural Independent Living. And I'm Mary Willard, and I am going to be running this call with you today. So again, for those of you who might be new to our community, you can turn on your webcam so we can see and hear you. And there's this tiny little video icon if you're on the Zoom. You can press that button and you have all the controls. You can mute and unmute from home as well with that little microphone there in your controls. If you're just on the phone with us today, you should be able to press *6 to mute and unmute. Or if you've got a mute function on your actual phone, that is handy as well. If you press captions, those are available at this time. And if you have any trouble at all, feel free to either shoot me a question in the chat box, or you can email me at molson, molson.april@gmail.com, and I can open that up and try to help you the best I can. And again, for those of you who are just joining us, if you could fill out our poll, just pure curiosity. We're just wondering what's going on all out there in Sill Land. So just a few group guidelines as we're kind of getting to know each other and working today. Please stay muted if you're not the person speaking. It just kind of keeps that distracting background noise down. I'm going to do the same because I've got my whole family and my dog here, so you don't want to hear that. While we're building our community and getting to know one another, if you could just say your name and your organization, your SIL or your SIL or other organization, your city and state that you're from, before you make your comment or ask your question, just kind of helps put perspective on who's all here. And let's just have some fun, give each other some kudos, and remember, an old idea or thought to you could be groundbreaking for somebody else. So if you're in doubt, please share it. Again, as always, we had
independent living research can help you.
Oh, if folks could
yes,
just
hold on.
unmute from home, that would be helpful. I think I found you. So again, we had a great call last week on an April peer support call about nursing home transition, and that was wonderful. The recording of that is on the April website. And we've had several of these COVID check-in ILNet conversation communities, and those are also recorded on our website and ILRU's if anybody's interested in those. And with that, it brings us to today's exciting topic of the world of centers in COVID-19. Today, folks really wanted to focus in on kind of figuring out where everybody is at. Our centers opening back up. Do you guys have guidelines you'd be willing to share with others? What is it going to look like for you where you are? We've also had lots of questions around the CARES funding and how are you guys spending it? Are there creative ideas that you're doing that others could benefit from? And just kind of in general, checking in with everybody and seeing if you have any questions for your peers, any problems you'd like to workshop. Today is the space to do that. So with that, I also do want to mention that we are recording today's call. We like to make these available if anybody misses them, or sometimes you guys just don't want to be furiously writing down notes. So today's call will be recorded, just so you know, and you can access that by contacting me after the call. So would anybody like to be the brave soul who goes first to kind of just check in about What's the world look like for you and your center right now?
So this is, am I unmuted? This is Marilyn from New Vistas in Santa Fe.
Hi, Marilyn. I can hear
Hi.
you. Go ahead.
Yeah, so we got the word from our director this week. They had to have a building inspector come in to do a new occupancy, so we knew what our occupancy was, because we're only at 25% occupancy in New Mexico right now. So that turned out to be better than we hoped for. So we have about 20 plus employees with contractors. They told us it was 60, which means we can have 15 people in the building at any one time. So that let our director say, starting next week, she asked us to pick a day that we would like to be in the office. We're still working from home and doing all kinds of virtual stuff online with consumers, but which is good because we're going to continue doing that. This was actually a good thing that came out of all this crazy stuff, like teaching classes and stuff. But so I picked a day, we all picked a day, and so that she can actually schedule and make sure there's only 15 people in the building at any one time. We don't have to stay the whole day, but it gets us back in the swing of things. We have an early intervention component, which is a large part of our staff, which works from children 0 to 3 years old. So they've been doing telehealth and they will continue doing that. But out of the CARES fund, we're buying technology because the cell phones they were using, the batteries kept dying. You know, I mean, they just weren't built for this kind of constant barrage of, so we're getting tablets and a lot of things that will put us in a good position to be able to work with our rural counties. We cover 9 counties besides Santa Fe, and they're all very rural and more than 60 miles away, each one. And our class teaching, we're going to start with Kendra, our youth coordinator. We're starting with, who's been on a bunch of your calls, Kendra Garcia, is we're teaching the Montana classes because 2 of them are already set up for online, which is great. So those will start at the end of June. We're advertising right now. And then we have to do something with the Working Well because that isn't online yet. So we'll be figuring out how to do that. But she's already been advertising. It's on our website. It's on our Facebook page and all that stuff. And the guidelines are we wear a mask. We wash our hands frequently. Gloves aren't necessary. Keep the 6-foot distance. And today I met with a consumer in the parking lot because he needed, you know, he was in his car and he needed some paperwork to show another agency, which he couldn't find his and I had it. So I copied it and we had a short meeting. But generally it's been by phone. And we're starting with the upgrade. And then of course we have monies to help people because we keep asking consumers, is there something you need? And I did listen to that ILNet call on the 9th that was offered with Paula McElwee. That was very helpful. That was good. And I'm sure that's on the website. Okay.
Oh yeah, great. Thanks, Marilyn. What a wonderful amount of information. And just to follow up, so the Montana classes that she's talking about are those healthy community living classes. We talked about those. The University of Montana folks were giving away subscriptions in the beginning of the COVID. So glad to hear that you're going to be putting those to use.
Yeah, we actually purchased those. Before you started
perfect.
giving them away, we purchased it. But anyway, we're going to do it.
Well, that's perfect though. Great. Well, thanks for sharing all of that. Sure. Does anybody have questions for Marilyn or anybody like to follow up with, you know, what are you guys doing?
We have this is Mary Ann from Northern New York State, Watertown, New York, at Northern Regional Center for Independent Living. And we have very similar to what she just said about starting to bring people back in. And mainly, I've been here the whole time. I'm in finance, and my small team have been here every day, but we're bringing back people um, 1 day a week, and everybody's been working remotely. We have had to really come up with some uh, quick ideas and getting the equipment, and we are purchasing new equipment, computers and surfaces and things like that to so people aren't using their own computers at home. Also, we've been doing a lot of youth meetings online with Zoom, and we're getting groups together, working well with, it used to be called Working Well with a Disability, but it's like CDSMP, people with disabilities and staying well. And we do not have consumers coming in yet, but maybe in a month we will be. So it's like I think it was Marilyn who was just on. Was it Marilyn? I don't know. But anyway, getting people used to coming back into the office. And we have started just recently using that CARES money to help families or anyone in distress, like gas cards, if they need that, or diapers, or formula, or anything that they need. We've started using that money to provide those things for those people. That's just some of the things we're doing.
Thanks, Marianne. I think that's great. I think, you know, one of the reasons why we're asking what you guys are spending some of the money on is that, you know, we've heard from folks that, you know, you don't know what you don't know. So it's nice to hear what other people are using it on, so you can think about what the possibilities are. But thanks for sharing that. Who else would like to go?
My name is Nancy Penn. I'm with the Life Center in Lubbock, Texas. We have about 30 employees in 2 centers. There's one in San Angelo and one in Lubbock. We have usually a pretty robust activities going on in our center, and a lot of consumers who are there on a daily basis. But we stopped activities in March, and we're going to, and then we've been working remotely. We are planning on reopening in July, beginning of July, with staff that feel confident and comfortable coming back to work. We, of course, as a center, some of our staff are people with disabilities who have compromised immune systems. They may not feel comfortable. That's a choice they can make. And we also have people who have children, and so the schools aren't open. So we're allowing them to work from home. We have been trying to make sure that our staff is in contact with consumers to offer, even if nothing else, peer support, because they're isolated and they're not able to get out. So peer support has been a big part of what we're doing. We also make hygiene runs. We have a hygiene closet, so we're making sure that we can bring out hygiene items when certain items were just really not available in the stores. We had some, and we were able to make those deliveries. And we're coordinating with our local food bank to make sure that we have vouchers available. And so we're helping consumers to get vouchers for food and energy assistance and things like that. We'll be coming back on the 6th of July with a limited staff. My staff is very anxious to get back in the office. I didn't think they would be, but for the most part, they've been unanimously saying, yeah, I think we can do this. So we'll have PPE, everyone's going to have, but we'll have hand sanitizing stations. People will be queried when they come in to see if they have any symptoms. We still have some spiking going on here in Lubbock, not like you had in New York, but we are trying to keep it down low as much as we can. So we'll have guards again around the desks, and people will have their staff will have temperature taken when they come in. We probably will not be allowing consumers or activities back into the center till August, but We will be letting consumers come in. We'll probably designate office space that we can meet a consumer in an office and not have to have everybody have to sanitize it. If we can limit it to one office, then we can sanitize that one office over and over. And we actually had bought a sanitizing machine, and we had a couple of our staff go through there, and they just sanitized the entire building and our bus. So we're just trying to keep ahead of the game and keep things as safe as we can for the people who access our center and our staff.
Oh, thanks, Nancy. And do you mind me asking a follow-up? You said you bought a sanitation machine for your center and did you say your bus?
Yeah, we have a bus that we have. It's actually on loan from one of our local rural providers, but it's got our name on it, and we use it for transportation, for last resort transportation, and for activities.
Awesome. Thank you. Thanks for sharing.
Could
Does
I
anybody
add
have any?
something else?
Yeah, go ahead.
Okay, it's Mary Ann again. Something that I think is really cool, because our IT department of one created an attestation that we have to attest to every morning when we arrive at work, saying pertinent questions about, you know, have you been exposed? How are you feeling well? And those things that you need to know. So we don't have to go in and sign something. We do it right on our computers, and somebody is gathering that information to make sure that we are well and have answered the pertinent questions. It works out well for us.
Great. Thank you. Awesome. I think I saw Priscilla. Were you going to jump in? Did you have a question or a follow-up?
Sorry, no, I'm just jumping in late.
That was great. Great. Thanks for everybody for the info. Does anybody have any questions for those who have gone, or would anybody like to go next and just talking about kind of where you're at?
This is Rick in Augusta or South Carolina, combination there. I'm very interested in the bus, just a brief second or two. How did that come to be, and how can we get one?
Well, for us, Texas is huge, and there's a long way between any place you want to go. And so one of our rural providers had a program, and we work with them closely. We can provide trips where Lubbock has a very nice bus system, but there are limits as to how far they'll go. So working with them, and to be honest, I wasn't involved in the actual procurement process, but we do work with them. We make a report to them every month. The bus is technically theirs, but we have been using it for about 3 years, and it is something that has helped us to be able to provide transportation to our consumers who attend our activities, as well as, you know, our airport is 10 miles out of town, and so if people with disabilities want to be able to come to or from the airport, they don't always have a way. Even our DMV, where people, you know, can register, they can go to get their licenses, is out of town, out of the city limits, and the buses don't go there regularly. They make a trip occasionally. So we can help provide some of those things. It's not like a huge bus, it's a small one that does not require one of the CDL licenses.
That's nice to know. I'd like to contact you offline, because we have a system here financed by the Council on Aging, but they have surplus buses, so it may end up that we can find a way to enter into an MOU or something and have something happen there. They're more readily funded, but they aren't able to be responsive. And they want to be, but they're just not able to be. So that's an idea too, is for us to contact them. So thank you.
welcome. And I can put my email up on the
In the chat.
chat thing there for you if you'd like.
Great. Oh, I think that'd be great, Nancy, if you don't mind putting your email in the chat. This is exactly why I love these calls, is the organic way that peer support and connections happen. So thanks for the info and for the follow-up questions. Would anybody else like to go? Any questions you have for your peers, or if you'd like to give comments on where you and your organization are at? Scrolling through to see if I know anybody to call on.
This is Tanya. I'll go.
Awesome. Thanks, Tanya.
I'm from Independence First in Milwaukee, Wisconsin. So we have a very high COVID rate that has been increasing and decreasing. So it's all very confusing, but we are all working remotely, and we are offering all of our classes virtually. So we were successful in maintaining all of our high school classes virtually until the school year ended. And now we are offering our summer programming through Zoom, and we're very excited. We have a pretty high registration list already. So we are very excited to see the need and fill that void. We are using the CARES money for transportation needs, housing, unemployment here just was not, we have many consumers who were unsuccessful at getting unemployment during the last couple months. So we are utilizing that CARES money for rent and internet in all of our areas. So yeah.
Great, thank you. I think that's a great, you know, I always forget about transportation. So what does that look like? Do you buy like bus vouchers for folks, or how are you using the money for, yeah.
So a couple of our inner city consumers have requested some of the bus passes because they had loss of income, couldn't afford them. In some of our more remote areas, we approved one of our consumers for an electric bike because she couldn't have, she was not on a bus line. Taxis are not working in our areas at the moment, and she could not use a pedal bike. So we were very excited to approve an electric bike for her needs.
Oh, great. Thank you for sharing. I think that's a really cool, creative way to help somebody out. Great. Anybody else who'd like to share or have any follow-up questions?
I'll share. This is Michelle from the Resource Center for Disability Solutions in Florida. We've got 4 vans for transportation, and we, through most of the pandemic, we have been delivering food boxes that were provided by Feeding Florida. Our COVID funds, we've spent them on technology, updating in our office and purchasing iPads for our consumers to use. Our working policies, we have some people working at the office. The ones that like working at home are continuing to do so, and we'll probably do that through July. We've been using Zoom a lot for support group meetings and trainings. We haven't spent a lot of the CARES fund yet because we're still working out our policies. We're going to try to focus on the housing needs in this area. There's not a lot in terms of low-income housing. So we're going to develop a policy to help with deposits and utilities, food and that sort of thing for COVID-related evictions that are going to come up at the end of the month.
Thanks for sharing that. Would you mind, when you guys come up with some of those policies, would you mind sharing those with me?
I sure can, yeah.
Oh, That would be great. Anytime that we can get copies of policies or programs, it's just nice to not have to recreate the wheel for other folks.
Exactly. Yep. And I think a lot of our resources and ideas for our policies have come from other places. We just kind of compile it together and then fit it to meet our own needs here. Another thing we've done is, we did buy the sanitizing stations, the hand sanitizing stations, some steam cleaners for office equipment and for our vans.
Great. I'm curious about these the sanitation equipment. I'm not looking into it as much as I should, I think. But what is it that you buy? Or is it just something you buy like on Amazon, or is there a specialty company?
I really don't know where our executive director got her ideas from. I haven't seen them yet, but they're supposed to be really cool. They're these things that, you can use on your keyboards and your screens and the desktops. And then there's one for the van. I mean, it's like fumigating the whole office and every surface, but with steam. So it's going to be pretty neat, and I'm looking forward to learning how to use them.
Great. Yeah, let us know what you find out.
I wonder if it's anything similar to what the airlines are using to sanitize the plane after every trip. Southwest, I've watched them do it online because I usually fly Southwest when I go, but that's interesting.
I bet you it is. They're supposed to be pretty easy to use, and they're portable. So, I'm sure it's similar to that. If we can use them on everybody's office and everybody's equipment and use them in the vans, they must be similar to what the airlines go to the plane with.
Yeah, they're wearing it like a shoulder thing, and they're walking down the aisle of the airline and spraying all the tray tables and the seat surfaces and whatever they're using. I don't know what's in it, or if it has a smell, which I'm concerned about.
It's just steam, so it's going to be kind of like we're going to be Ghostbusters, but we're going to be Ghostbusters.
Yeah. Interesting.
Funny, because I didn't get it yet.
Great. Well, thank you for sharing. How about others? Does anybody have questions for their peers, or anybody like to go next? Kind of talking about what are some of the things that you're doing? How are you getting ready to come back?
This is Rick again in South Carolina. Walton Options for Independent Living. I'm fairly new to this, but I've sat in on a couple of the calls before. We're doing something similar to what I've heard. We'll be on alternate staff, and we moved some of the desks around. We are waiting for a particular piece of furniture that will separate a consumer that may come into the lobby before we allow consumers into the lobby. But beginning next week, we'll be alternating. Now that's the South Carolina side. We have another on the Georgia side. There may be somebody on the call from our Georgia counterpart. They have many more people in their buildings than we do. And so they're faced with other traffic problems. But we don't expect to have consumers probably another 2 weeks come into the office. And even then it would just be one or possibly two at a time. We had to relocate our front door in order to accommodate this.
Wow, thanks, Rick, for sharing that. And what about CARES Fund? Did your center get CARES funding? What are you guys using it on? Do you know?
We're still, we've done some with the technology. We've done some with, and I'm not part of that. I just get a little drifts and drabs. The admin is handled primarily on the other side of the river, on the Georgia side. One of our difficulties, and I'm going through the forms when this call started, is how much latitude do we have as to what is directly COVID related? I have one example where a consumer, not known to us before, was told to leave a place where she was staying because of COVID. There's no landlord relationship just said, get out. So this gal's been homeless, and a few agencies have been putting her up in a hotel. So I'm going through our forms and local policies to see if that's something that we can help with. To me, it's directly COVID related. And then we have another case where a family in an upstairs apartment had a tiff, possibly COVID related. It's hard to document that. He fired a weapon, didn't injure anybody, but it set off the sprinklers. And so I have a number of people in an apartment complex that are vacated, thrown out because the sprinklers went off. So I'm trying to see if I can relate that. Do I have to have a police report that says nobody went to jail? It was a discharged firearm. But so there's some things like that where I'm hoping the program director here locally can give us some guidance. My background before I joined Walton Options was very heavy into the service network. In fact, I presided over a number of monthly gatherings of different service providers, more as a hobby than anything. So I'm learning also how to formalize, how to document what I have done for a long time without documenting. I still have all of the connections and contacts, and I feel competent to be of assistance, but I'm still learning the red tape, the PPI kind of thing, or PII, and so I'm hoping to be up to full steam here in another couple of weeks. The COVID hasn't interrupted with me specifically, even though I'm in the elder age group. I'm blessed with extremely good health. My disability is a finger injury from the military, so it's not particularly disabling with respect to my being able to help others. So I'm glad to visit with the people, and I feel like I've got friends all over the nation.
Cool. Thanks for sharing, Rick. Does anybody have any thoughts for Rick? Any answers on, have others used some funding to help housing, some care funding to help people find housing or get into housing?
Hi, this is Kathy from Northwest Georgia Center for Independent Living. We just don't have any. There's no housing available. I mean, it's horrible. And it was worse before COVID. I do believe it was worse before COVID. But on the other hand, with the CARES funding, we have been able to help a couple of people that needed ramps and some other small modifications to their homes so they could access them better. And that's a good thing.
That's great.
Yeah.
Thanks, Kathy. Yeah. Some doing some home modifications. I've heard of other folks doing that as well.
Yeah. A lot of it came down to, well, it's fallen back on families now to take care of some folks, so this is what they're doing. And it's hard to get mom and dad. They didn't realize before, but it's hard to get mom or dad or somebody out of the house when they weren't having to do it. And now that they're having to do it, they're realizing how hard it is, what kind of work is involved in it. And it's been an eye-opener for a lot of people. We have 15 counties up here in Northwest Georgia. It's been an eye-opener for a lot of people. So we've been working remotely. I'm going to say it's been a good experience for us because it kind of got us out of the office and, out in the mainstream a little bit. So it's a two-sided sword, I think. But we're going to try to go back next week. So we'll be doing a lot of the things that Nancy and everybody was saying, that, the testing out or whatever. And, the assistant director is going in today to get, to be there with the people that are coming in to disinfect the office. So that was a kind of hefty expense that we weren't counting on, but we're glad we've got COVID to help us with it. It was almost $500 for for them to come in and clean our little office, disinfect our little office. So, but that's
This is
that's it is what it is.
this is
Thank
this is
you.
Hi, this is Kathy Kay, and I'm the CEO of the League of Human Dignity. We have 3 centers in Nebraska, and they were actually standalone centers, and they all got rolled together. They're not really satellites, but that's a long story. But we had a meeting yesterday that we were with some other independent living partners, and to address your question on housing, they had a good idea, and I thought I could share. We aren't doing it, so I can't give you the specifics, but one of them, it was with our region 7 nickel meeting that we had with our region. And one person at one of the centers was working with Habitat for Humanity, using some of their COVID CARES funds to either go in and rehab houses so that they would be accessible, or even working. So that's an idea, because I know that that's one of the things they really want us to be spending this COVID CARES money on, is, you know, trying to get people out of the nursing facilities or keep them from going in. So depending on how much COVID money you have, that might be an option. And to answer what you asked earlier, we are still not open to the public, but we have been operating in our offices. We have not been operating from home, but we have in our 3 offices in Nebraska, and then we have 1 office in Council Bluffs. We have a Center for Independent Living there in Iowa as well. We've been in the office, but we're doing social distancing. We're wearing masks when we leave our individual offices. We're sanitizing, we're cleaning. We have no plans to be opening up as of yet. We're providing all our services remotely, and we're spending our CARES money on PPE, sanitizer, gloves, antibacterial soap, masks that we are giving to people, because we feel, to our aisle consumers, because we feel that is really important in stopping the spread. We think that wearing a mask is really important for the consumer, for the people that take care of them, the people in their house. So we're trying to do that, and we're spending a lot on technology because we're having to provide services remotely. And I think we're all feeling that pinch, and it's really tough, and a lot of people didn't have computer equipment with the cameras so we could do the Zoom. And so we're buying those and spending, we're going to be probably spending the bulk of our money will be on providing that equipment, the technology, and also a lot of people then didn't have internet service. So then we're going to buy like the hotspot, like a phone, like a burner phone, so that they can have a hotspot. So that's how we're using our money. So, and thanks everybody for being on this. It's really nice to hear all across the country. It's nice to hear you, and especially you people in Texas. That's where I'm from originally. So good morning.
Awesome. Thanks, Kathy. Oh, awesome. And Priscilla's wondering, Kathy, if you don't mind connecting with them. Actually, I was wondering if I could ask you one other follow-up question for those talking about they're updating their technology. I've been asked by a couple of SILs, how are you deciding what to buy? Do you have IT staff, or are you, getting recommendations from people, or how are you guys deciding on what you're going to buy?
I can answer for us. We do have a person that works with us on IT, but we are also, each individual consumer, it kind of depends on how comfortable they are. We have been very lucky in Nebraska. We got a very large amount of COVID money. And so we've been very lucky that way. We are buying, they're a computer that flips over to a tablet. And they're pretty pricey. I think they're about $800. But that is really going to be easy for people, we hope, to use. We also are having to factor in on this cost of technology, the training component. How will we train people to use these? Because that's a really important IL training skill. And how can we do that safely during COVID? And we haven't crossed that bridge yet. Hopefully they will have, like in my house, a smart 7-year-old that'll help them work on things, because that's who I go to, is like, my children, grandchildren, because I'm a little technology behind myself. I hadn't done Zoom until COVID. but we're gonna pre-install Zoom on the computers and have everything so that it can go and click a button. And then we also are working with Easter Seals in Iowa, maybe to do some of the training component. We haven't approached them yet in Nebraska. We haven't gotten to that point. But the other thing is, iPads are really pretty easy for people if they just want to be doing like FaceTime, and that's another option. And so they don't really need to be having a keyboard and typing. That can work, and pre-program in phone numbers so that it would be easier. So we are picking, right now we're starting with those one computers that flip over to a tablet. We may be switching to just tablets. We're gonna kind of let people tell us what they are more comfortable with and what they want. So if anybody has a better idea on what's an easier thing to use, I know I love my iPad. I think it's easy to use. It's big enough. But when we're working with transition students, we feel like they're really going to need that bigger computer. So I don't know if that really helps, but that's just kind of where we're at.
Thanks, Kathy. I think that's great. And H. Velasco is wondering, are you providing those computers to consumers? Are they theirs to keep or just to use or during COVID?
Well, we were going to do like a checkout program, but then recently I was told that with purchases made, technology with the COVID CARES Act, and please somebody tell me if I'm wrong, I believe that people can keep them. And I see somebody nodding their head. Is that the way you interpret the ACL guidelines on that? I believe we can give them to them and we do not have to get them back. We're gonna start as a, call it like a rental, or not rental, a loan program, not give them to them. Now the burner phones, yes, we'll give them those. And then when the COVID money runs out, CARES Act money, I always call it COVID, sorry. When it runs out, then it runs out, and then they won't have that internet possibly anymore. Those we don't want back, and we don't have to give back. I believe though that that we can let them keep that technology, and if I'm interpreting wrong, please somebody let me know. But we are going to start out, call it like a lending library type of thing, and I think that might be a good idea because people we might have more of a, we can't buy a computer for everybody with our money, no matter how much you have. I mean, the sky isn't the limit. And some people their goals might be open. This is what we want. We want training on this. We want to learn how to maybe cook. And then we close the goal. So then we really don't need them to have that equipment. Mm-hmm. So we're going to call it lending library type of thing for now. But I believe we can give it to people. So if somebody says they really need that to be able to work, that's their goal, they need that computer, I believe under this money, you can give them that and not have to get it back. Which would make sense, because why would you want all this? I mean, it doesn't, but then again, it's the government and they don't always do things that make sense, so.
This is Rick in Walton Options again. We had that dilemma. I don't know if the final decision was made, but we decided pretty much to go with Chromebooks because they're so much less expensive, and many of the schools interface with Chromebooks. The difficulty is you can't do much or as much for sure unless you are connected to the internet. But those were more disposable at $175 or $200, and $800 was one of the best prices we could find for iPads.
Great. I think this is a really great discussion. And Kathy, I'll be honest, I don't know the answer to your question. I don't know if there are folks on the call who know. I've not heard that you can't give it to them, but I don't really know. Because you're, and I think that's one of the nice things about these conversations, though, is it's a good way to kind of check in with other people. I wanted to double back also on your idea that you had about onboarding consumers to the technology. I think that's a really great point. That's something that I know we've been discussing over here. We work at April, we work closely with some of the folks at the RTC who do that healthy community living online curriculum that was mentioned earlier. And we've been talking about, how do we really help orient consumers to the process? So teaching them how hide their self-view if they want to, talking about finding a space where they aren't distracted, or, you know, maybe that they feel more confident showing people, or teaching them how to put a virtual background. So, yeah, I'd love to learn more about that, Kathy, as you proceed. And if you have stuff that you'd like to share, we'd love to share it with others.
This is Beth James from Mayfield in Jackson, Tennessee. And
Yeah,
on the equipment, one thing that we've done, particularly with our consumers who were deaf, some of them didn't have smartphones, and they really rely on like, you know, Messenger and different things, and rely on our interpreters to be able to help them. So we've done the little Kindle Fires because they're only about $70, $80, and you know, it seems like a really reasonable cost that they can even keep them, and it helps them stay connected to their family too, and just a lot more reasonable cost for us, you know.
great, thank you.
And it does have, there's a Zoom, the Zoom software will even go down on, well, you can download even Zoom for Kindle. So they've been fairly, you know, it's been a cheaper alternative for us. I'll just put it that way.
I says it's $5.99.
Thanks for sharing. That's great. Anybody else want to talk about, you know, what they're doing with technology, how they chose it, or what's it look like opening up? Or what other things that you're doing with your CARES funding? I'm also curious, last week we had a really in-depth call about nursing home transition, and a lot of folks were using money for that, as from the CARES funding for that as well. So others that would like to share.
Hi everyone, this is Leo Santos from NWCCI, and that's Northwest Colorado Center for Independence. And we're located everywhere around Northwest Colorado. We have a whole bunch of offices around here. And I am the youth peer coordinator in Summit County. And basically our supervisors told us that we're free to start seeing consumers at our offices, but we have to make an appointment. Obviously, no more than 6 people at the office, 50% capacity, and everybody has to wear masks. And then we've started seeing our consumers, the ones who have been willing to come out and just take a walk with us, hang out. Since businesses are starting to open a little bit, some consumers have been wanting to go out and get a bite to eat. So some of us have been doing that. Our CARES Act money was used to update technology. We used it to update our telephones, some laptops, computers, things like that. We do have, I was going to call them buses, but they're not buses, they're vans. We have vans available for people who can, because some of our consumers are located out in the middle of nowhere, and they have no way to get to their doctor's appointments and things like that. So we have a couple of vans that was provided to us by CDOT. The funding was provided by CDOT. And for those who are not familiar with CDOT, it stands for, one second, I have to pull it up because I'm not familiar with the thing to say.
Colorado Department of Transportation?
Yes, that's correct. There we go. Yep. It's like I always use CDOT, so I don't use the actual thing for it. But yeah, that's what we use. They funded our vans, and I'm very new to the company. I've only been working for the company a couple months, 4 or 5 months, but I've been a consumer for over 2 years. And so it's been a transaction working having to stay at home, calling consumers from home, and making sure they have their meds and they have food, access to food, and stuff like that.
Great.
Yeah, but right now everything seems to be going smoothly so far on seeing consumers. Some consumers are still very cautious and still don't want to come out of their house, but some of them are still coming. Some of them are willing and are coming out. And obviously, when they come to our offices, we pick a day when nobody comes in except for one person to clean the whole place. Since our office isn't that big, it's big enough for us to have consumers and keep it below 6 people.
Great. Thanks, Leo, for sharing. I think that's, I'm making a mental note for a future call when we're done with the COVID check-ins. I think it'd be great to hear. I've heard from several centers now that have a partnership with their local Department of Transportation and have their own transportation vehicles. So that's something we'll have to dig into in the future. I'm curious to hear more about that from folks.
Yeah, it's great. I'll just give you guys the contact info of who does all that stuff for us.
Yeah, that would be great, Leo. If you don't mind dropping it in, it'd be great to be able to connect with them. Awesome. Who else would like to share or ask any questions that you'd like to workshop with your peers?
Can you hear me?
Yep.
Okay, this is Ricky Lee from Bloomington, Illinois, and we have 4 counties, very rural counties in our service area, and only one of those counties is covered under the Part C CARES Act money, and we're working out.
Sorry, can you move in a little bit closer, maybe?
Okay, can you hear
Perfect.
me better now?
Yeah.
Okay. So we have 4 rural counties in our service area, and only one of them is covered under Part C. So only one of them, technically falls under the CARES Act money. I was wondering if any others have that same issue and how they worked it out with their project officers. I know there's the over county lines, but that says that if it's just got weird language in it. We're trying to change the state bill for next year to do that. Just would like some clarification on that from others more experienced.
So Ricky Lee, let me see if so the question is, so you have a few centers, but only one of them got the CARES funds, is that right?
So counties.
Oh, counties.
Yes. Only one of our 4 counties are covered under Part C.
Okay.
So our question, we have in the state, we have 5 bills who are barely exact similar to me, and we're all trying to work through this different information we're getting back from ACO.
Does anybody else have experience with that? So Ricky Lee is wondering if you have several counties that you're still served, but you only have, one of those counties that you're using C funds for. How have you kind of worked that out? Let's see if anybody else has the same experience. Does anybody have thoughts on that?
Muted. Okay. Can you hear me now?
Yeah.
Okay. So when I was on that call with Paula McElwee on the 9th, I think it was, and we talked about how funds are used, that conversation came up. We were the first center in the state. We were federally funded. We served 9 counties. There are 2 others that we spun off during that initial year when centers were being formed around the country. And they are also federally funded. They are the only centers, only federally funded centers got this CARES Act money. So the 2 state centers did not. And so one of the questions on the call was, is it okay to be generous and share. And she said, absolutely not. You need congressional approval. This was passed by Congress. We don't have the authority at ACL, is what she said, to override a congressional act. And unfortunately, that can't be done. Okay, so that's where we're at with that now. And she was talking about partnerships, not Paula, but the woman on the who was asking the question. So my understanding is they have to be, so you need to know how those other centers are funded, I guess, is the question. But it's not okay. And then you really need to have a paper trail, whatever you're using for criteria, whatever your best guess is how to make it whatever you're going to spend it on so that it fits within the criteria of that act. But you can come up with some pretty good stuff. It's just you can't share it with centers that are not federally funded. So they're the only ones that got the funds, and that's the way the act reads, unfortunately.
And that's
Right,
true.
I understand that. It's my center serves, one center serves all 4 counties. We have a satellite office in the county that is Part C, federally funded, but the other 3 counties are still served by us as well. There's no other cells. We're it. It's the county, it's the area.
So she has, so you were a CARES Act SIL, so they did get the money, Marilyn, is what she's saying.
Oh,
but
okay.
Because of the way that they sparse their funding out in their SIL, their C funding really only covers one of their 5 counties, or one of their 4 counties. And so that is a lot trickier question, I think, Ricky Lee, and I think probably, I don't know if you said you have or not, but if you worked, working that out with your program officer, because I just don't know. That is different than the question that you heard, Marilyn, which we've heard the answer on of sharing it between SILs, but you're wondering, as one SIL, can I share it between my counties? And that seems a little,
on that call, Mary and Ricky Lee, they said it's your service area that those funds are for. So we serve 9 counties in North and Central New Mexico. Those counties are our service area, and we can share those funds with any entity or consumer in those counties because that's our service area. But we can't use the funds outside our service area.
No.
And we also can't share with the state funded. There are 2 state funded SILs, and the money can't be shared with them for anything as well. So our service area is pretty big. So I would guess that you could share it with others in the counties that your SIL serves.
Gotcha. Okay.
And which include your satellites, because the Albuquerque Center has 2 satellite offices, and they're a state-funded center in New Mexico. So their satellite offices would be part of their SIL. So that's my understanding.
I was going to say, couldn't you get your program administrator to clarify that for you? It would be better to have something in writing,
Sure.
I'm just saying.
Right, absolutely agree, and we're trying to do that. It's just our old project officer at ACL changed, so now we're working with somebody new and trying to start from ground zero.
oh, understandable. Well, I'm glad though. It sounds like we got at least some feedback. I'm glad, Marilyn, that you were on that call and listening so closely. How about others? Any other thoughts on Ricky Lee's question, or does anybody else have questions or info they'd like to share? I think, and we're, gosh, already at the top of the hour here. So just wanted to check in quick with folks and see if anybody has other thoughts or questions that they'd like to share. Does anybody have, Oh,
I
go
think
ahead.
it's really early in the game when we're just starting to get opened again. So that's all I'm saying. This is a good beginning conversation, but we're all just starting to dip our toes in the water and decide whether we're going to keep this remote virtual stuff going, which I think is most people are doing and investing in. And I think it's a new era, you know, it's kind of exciting that those things are, the youth coordinators are great help. We do have one finally this year. So actually this is her second year. So it's great, you know, that, and we're part of that IL, the training, the youth training thing. So we're developing that program as we, for the next 6 months. So that's exciting too. Anyway, this,
Oh,
I just wanted to say, everybody, thank you for the information that's been shared today.
great. Yeah, and thank you everybody for coming. You know, and I'll be honest, I don't even remember how long I booked this call for. They used to be 90 minutes, but I think they're an hour now, and I've already gone over. Can you believe that? But I did want to mention, so you mentioned we do have Youth Coordinator Connect peer support calls as well. So definitely get in touch with us if you have a youth coordinator and you'd like for them to join in. And I think that you're right. This is just the very beginning. I'm glad that we were able to kind of touch base today. If anybody has more questions they didn't get to ask, feel free to email them to me. Please send me also if you have any info on what you would like future calls to be on. So we've kind of hit this COVID stuff pretty hard. Like I said, last week we had a call on nursing home transition peer support, and we had over 200 people there. And so I think that's something we're going to continue as well. So keep your eyes open for that if you'd like to be a part of those calls. And please feel free to evaluate. You can see the link there. You can just copy and paste it and throw it in your screen. It's just a nice way for us to kind of keep in touch with you to see how we're doing. So thanks everybody for joining. And we will be in touch soon.
Thank you.
Thank you.
Bye, everyone.
Bye. Bye.